Today we're going to start a very important chapter, which is actually for furcation from the Karenza. So basically, let's start it. Bismillahirrahmanirrahim. Furcation basically is a very important in diagnosis. Is a It is a complication of the periodontal diseases. We have also problem in treating these type of complications at the same time, and their prognosis is also doubtful. So let's start it. Bismillahirrahmanirrahim. So basically, furcation, it is an area of complex anatomic morphology. Means the anatomy is very complicated. Okay, now basically there is also difficulty or impossible to debride. Means it is very hard to clean the means impossible to debride by routine periodontal instrumentations. Mean the way we do the routine scaling or routine checkups by periodontal instrumentation, it is not sufficient to actually treat the furcation. So in inflammatory diseases, when they are not treated and they progress and they have attachment loss sufficient, so what they affect the bifurcation or trifurcation of multi-rooted teeth. Okay, then basically it is very also hard from the routine home care methods that you can keep the furcation area free of plaque. It is a clinical finding which I have told you in diagnosis of advanced periodontitis, and the prognosis is less favorable for the affected tooth. It also presents with diagnostic but as well as the therapeutic dilemmas. Means the conflict of treatment in these type of complications. Now moving towards the ethologic factors, that which ethologic factors are involved. So the primary ethologic factor in the development of the furcation defects is bacterial plaque. Means the plaque is involved in developing the furcation when it is not treated actually, and the inflammatory consequence means there is inflammation, so the complication consequence is bifurcation from the long-term presence. The extent of attachment loss is required because when there is an attachment loss, so there will be a recession. When there is recession, so the furcation area will be exposed, so there will be a furcation defect and there will be plaque accumulation and many more. This is related to anatomic factors, which is root trunk length and root morphology we will study, and local developmental anomalies like cervical enamel projections. Local factors that also actually affect the rate of plaque depositions. Means the local factors also affect the rate of deposition. It also affects the oral hygiene procedures and contribute to development of periodontitis and attachment loss. The prevalence and severity of bifurcation actually increases with the age. Dental caries or pulpal death also affect the tooth with the furcation involvement. We have said that plaque is one of the factors. Then we have said dental caries is, and when the pulpal death occurs, it's also a help in the furcation involvement. Basically, by considering these factors during diagnosis, treatment planning, and therapy of the patient with furcation defects is very important. So the most important primary factor is plaque. Then there is inflammatory process, so for a very long time when it is not treated, so it involves the furcation area. Okay, basically then you have dental caries and pulpal death. Now moving towards the diagnosis and classification of furcation defects. When you thoroughly study or when you thoroughly clinically examine, so it is a key to diagnosis and treatment planning. Okay, so how you examine by useful or careful probing, which is very important to determine the presence or extent of furcation involvement. Means you properly probe, so in order to determine the presence and extent of furcation involvement, and also the position of attachment that is relative to furca, and how much it is extended first of all, and what is the configuration, the shape of the furcation defect. Neighbor probe is used for it, actually, that measure the focal area. Transgingival sounding may also further define the anatomy of the furcation defect. What is the goal of this examination is to first of all identify that is it either furcation or not. Second, classify. You have to classify whether which class of furcation is involved. Then identify the factors that has contributed to the development of the furcation defect, because these factors affect the treatment outcome. What are the factors? It will be morphology, the position of tooth related to their adjacent teeth, local anatomy of the alveolar mucosa, configuration of bony defects like we say one wall defect, either two wall defect, three wall defect, the presence of extent of other dental diseases, that either any other disease is present or not, like caries, like pulpitis, pulpal necrosis. These are the dimensions given for the furcation entries. 81% furcation has the orifice 1 millimeter less. In 58% it is 0.75% or less. These dimensions, this anatomy will be considered during the. According to this, you will select the instrument for probing. A probe is actually a small sectional dimension which is required by the clinician to detect the early furcation involvement.